Hi guys, thank you so much for joining again for another video. Thank you very much for those who are returning subscribers and for those of you who are new. Really appreciate seeing you here. Today I have an amazing pharmacist on with me today. Her name is Regina. Today I wanted us to kind of go over and talk a bit about life working as a pharmacist and living in Dubai. So working and living in Dubai, what that's like. Dubai is one of my favorite cities in the world. I love the UAE. I love Dubai. I love anything to do with the Middle East, to be honest. And it's one of the places that I love to visit. And, you know, whenever I go on holiday, I'm always like, I want to move there. It'll be so great. So I want to kind of like, you know, just see what life is like for someone who actually lives and works there. So give us a little intro about yourself, who you are, what you do, and something fun, a fun fact about you.
Well, first of all, thank you, Ori, for having me on here. It's really a pleasure. So a little bit about me. So I am originally Mexican, but I left Mexico when I was really young, when I was 5 years old. Then I moved to the States for a few years, for 4 years, and then I moved to Dubai when I was 9 years old. So I pretty much grew up here in Dubai, which was nice because I was exposed to many different cultures, many different things. I think it's something about Dubai that um, opens your mind up to many different cultures. There's not one, you're not used to one thing. You see a lot of
Mm.
different things, and that kind of becomes your norm, which is nice. I left to uni to Canada for 2 years, and then I moved to the UK again for uni.
Mhm.
And now I am officially back in Dubai again after going back and forth throughout uni and throughout working in the UK. And now I officially made that move to come back to Dubai. So this is where I'm at the moment.
You know, for me, moving to one country was so tough. So I can't even imagine going from different parts of the world, so Mexico to the States, then to Dubai, and then to Canada, and then back to Dubai. Just all of that is just a lot, and it's very it's just like wow, like it's amazing.
Yeah.
Let's go back to moving to the States. What inspired that move?
Okay, so I was really young. It was from 6 to 9 years old. So I don't remember as much, but of course I do remember it. It was all for my dad's job because he's a pilot. So we would move around according to his job. So we moved there, and that's where I learned English actually. And I liked it. I really enjoyed it. I lived in San Diego in California.
Nice.
Yeah, and it was a beach place. So ever since I was young, I've lived in a hot country.
Mm.
So I think being in the beach just is the place for me.
Into Canada, sorry, for uni. So again, what was that move about and why Canada? Why not Dubai? Why didn't you study like in Dubai?
Okay, so that's a really good question. So most people, schools in Dubai are amazing. They're really good quality, and we have various programs. We have the IB program, we have the
Mm.
GCSEs, and A levels, and we also have the American programs, which I'm not really sure what they're called, but we have
Mhm.
everything. So I
Mhm.
decided to do the IB diploma because that would give me options to go literally anywhere in the world because I didn't
Mm.
know where I wanted to go.
Mm.
When it came time to apply to uni, I wasn't sure what I wanted to study. I knew that I loved the human body. I knew that I loved everything about health. I've always been a sports enthusiast. I was in every like sports team. I
Mm.
loved working out, loved taking care of my body, everything. So I wasn't sure exactly what I wanted to study.
Mhm.
And I didn't think of the UK at all, actually. I don't know why in my mind I knew that I wanted to either go to the States or Canada. And a lot of my friends were going to Canada. So
Mhm.
I thought, you know what? I think it'll be good to go to Canada because at least I'll know people there. I won't be alone because,
Yeah.
moving to uni is already scary as it is if you
Yeah.
go alone.
So you done, I guess, the undergrad in Canada?
So, okay, so this is what happened. Since I didn't really know what I wanted to study, I thought maybe I want to study medicine, maybe I want to study nutrition. Another course I was really looking into was kinesiology. And
Mm.
I really wanted to do that program, but my family was telling me, no, don't do kinesiology because you'll just end up being a personal trainer. Think of something else that would be better for you. So I thought, okay, you know what? Let me go into life sciences, which is what most people end up doing when they go to undergrad in Canada. I'm
Hmm.
not sure about the States, but in Canada, a lot of us choose life sciences, and then you either go the pharmacy route or you go the medicine route.
Yeah.
Because you know how it is in Canada, you have to do like the undergrad and
Undergrad.
then you apply to grad school.
Yeah.
So I actually only did 2 years of the life sciences. I dropped out of uni. I didn't finish it
Hmm.
because I went to a talk. When you're in your second year of life sciences, you kind of specialize into one area that you're most interested in,
Yeah.
whether it's biochemistry or pharmacology. So I went to this talk and they were
Hmm.
talking about pharmacy. And it's the first time I ever heard about clinical pharmacy. And that really opened up my eyes. And I was like, wow, this sounds really interesting.
Mm,
So I can be with patients, but at the same time, keep that science, the chemistry, which is, all the pharmacy part of it.
yeah.
So I thought, okay, this is what I want to do. That's it. I've decided this is what I want to do. And I realized that it was so difficult to apply to pharmacy in Canada because not only do you have to get really good grades, of course, in the undergrad, then you have to do the PCAT. And then after the PCAT, you apply to pharmacy school. And apart from the process that it's obviously hard, it's going to take so long. So then I looked into the UK and then I saw that you could go straight to pharmacy from high school.
Yeah.
So I thought, you know what? I'm not going to waste my time anymore. So I dropped out of uni
Hmm.
and I applied to unis in the UK and
Hmm.
then I just moved to the UK.
So you moved to the UK. What pharmacy school did you go to, and how did you have a process of choosing which pharmacy school to go to in the UK? How was that like?
Yeah, so I applied to quite a few. I can't remember. I think in London I applied to King's,
Hmm.
um, and then a few other ones. And I ended up going to Medway School of Pharmacy in the end,
Yeah.
in Kent, which is that combination of Kent and Greenwich.
When you were in pharmacy school, did you have an idea of what you wanted to do after pharmacy school? And if so, how did you kind of plan your journey to get to that point after pharmacy school?
When I found out about clinical pharmacy since Canada, I already knew that I wanted to work in hospital pharmacy. I had that super clear, no potential community or industry or anything like that. I knew I wanted to work in a hospital.
Mm,
So when it came to applying to pre-reg, I was taking no for an answer to get into a hospital. So I literally worked so hard to make sure that I would get that hospital position.
mhm.
And yeah, in the end I did. So I ended up getting my pre-reg position in Brighton.
Okay, cool. So you done the pre-reg year and then you worked as a pharmacist for 2 years, right?
Yes, in
And
the
then
same
you moved,
hospital.
yeah, then you moved to Dubai,
Yeah.
back to Dubai, right? Okay, so what
Yeah.
was the transition like going from the UK back to Dubai, finding work, and I guess the journey into that kind of space?
So one of the reasons why I moved back to Dubai is I always contemplated it, and because the weather in Dubai is so much better, as we've been
Yeah.
saying. Um, and I always thought I wanted to come back, but I knew that pharmacy still wasn't well established in Dubai. So I was waiting, and I knew I had a good job in the UK. So I just kept it as all come go and come back, and I left it at that. But then obviously COVID hit, and the lockdown in the UK was just crazy, and I just didn't see like it ending anytime soon.
Hmm.
So I thought in my mind, why don't I go back to Dubai for a bit? I think pharmacy
Hmm.
has advanced a bit. I did minimal research, to be honest. I thought I did some research and I thought that there was some clinical pharmacy. So I thought, you know what, let me just take the leap. I'll go back to Dubai. I have 3 years of working experience. From what I saw, they needed 3 years of working experience for you to be a clinical pharmacist in Dubai. So I thought I have all the requirements. I have a UK degree. I've been working for 3 years. I'm sure it'll be fine. And another reason why I moved back as well is because um I'm still interested in all of this like holistic health and fitness and all of that. So I thought, you know what, if I come back home, I'll be able to do that side thing that I've always wanted to do as well.
Yeah. Yeah.
So I thought, you know what, I think it's the right time to come back. I've done my postgrad certificate. I've done pretty much most of the things I needed to do. So let me come back. And I got a huge surprise when I moved back. As soon as I came back, I put in my paperwork to the regulatory body here in Dubai,
Mm.
which is called the Dubai Health Authority, which is somewhat like the GPHC in the
PC.
UK.
Yeah.
And when you're a pharmacist overseas, you have to get like like a certification saying that you have no fitness to practice or anything like that,
Yeah.
and submit
Yeah.
all of that. Did everything I needed to do and submitted my application, and then I get back that I apparently don't have the qualifications to be a clinical pharmacist. So you can imagine my frustration that I just couldn't believe it. And the problem is here in Dubai, people are very like black and white. So if the paper doesn't say one thing, that's it. There's no, you can't think about it. The paper doesn't say it, so it's not it.
Yeah.
The reason why they gave me such a hard time is because I have an M farm plus the postgrad. What they wanted to see was a Pharm D, because that's what their paperwork says, that they need to see a Pharm D, which is, you know, the degree that they do in Canada and the US.
Yeah.
So here in Dubai, they still have this difference between clinical pharmacists and pharmacists. So pharmacists are the ones that work in retail, and the clinical pharmacists are the ones that work in hospital. But then again, there's very little clinical pharmacy, almost none. It's only in Abu Dhabi, if I'm honest, where it's the most clinical pharmacy, in Cleveland Clinic. That's where they have really, really good clinical pharmacy.
Yeah.
However, it's worth mentioning that when I applied, because I do have a UK degree, I don't have to do an exam to get the pharmacist license. So it's really strange because the way you apply, it says if you have a UK degree, you don't need to do any exam, they give you the license straight. So, but of course, not, again, not the clinical one, just the pharmacist one.
Mm.
So I ended up getting that. But it's still, the thing is, you need to have an employer for that license to be activated.
But what I find interesting is that in Dubai they have pharmacists and clinical pharmacists. So like what? So in order for you to like, what are the differences? What really makes it different? I don't know, because I'm guessing as a clinical pharmacist or even as a pharmacist in retail, you know, your knowledge is pretty much the same.
Yeah.
Maybe the experience might not be different, might be different because maybe in hospital you're looking at lab work and in retail you're not. But there are many countries now where you have access to lab results and things like that, even as a retail pharmacist.
Mhm.
So what are the differences in terms of what they do in Dubai, like, you know, the clinical pharmacists in hospital versus the ones that work in retail?
Yeah, so the ones in retail, they're, I think most of them just have that B Farm degree. So they don't have that Pharm D degree.
Yeah.
So I think that's why they only get that pharmacist license.
Hmm.
And even here, the retail pharmacies, they don't do as much clinical work. Like from what I see, and when I used to do internships as well, when I used to come back, you know, just to get experience, I would see that the pharmacist would, they would ask a few questions, but not as many questions as we would in the UK to give
Mm.
someone a medication. So I feel like it's more of a business, even though obviously community pharmacy is a business, but they do just kind of more easily sell you the medications rather than making sure that everything is appropriate. And they don't really have like counseling rooms either.
So do they have
Yeah.
like standardized prescriptions? You know how in the UK we have like FP10s and all that stuff. Do they have that? Are there rules around like control drugs and all that kind of stuff?
No, not really. And it's really so here the thing is that it works with insurance, right? So it depends what type of insurance you have. And then that's why sometimes pharmacists are a little bit more lenient because with giving certain drugs to people, because some people don't have insurance and they can't afford their medication. So I've seen that some pharmacists kind of will just give them what they can because they can't afford to go to the doctor to get that prescription.
That's crazy.
I know, and even the rules around control drugs are there, and they have something called semi-control drugs as well.
Mm.
Um, but they do have laws around them, but I'm not too sure about how it works too much in community, to be honest. Um, but it's not as clear cut as the rules are in the
I
UK.
think that one thing I'm realizing more and more, the more I kind of like, you know, explore speaking to people from different countries, I'm so appreciative of my training as a pharmacist in the UK.
Me
Like
too,
I feel
really.
like I feel like, and sometimes I think some people may see it that it comes across as like, oh, you guys are just like stuck up and blah blah blah. But
Yeah,
actually, the more you realize and you go through the different systems of other countries when it comes to pharmacy, I
yeah,
appreciate the system we have in the UK so much. I
yeah,
appreciate the fact that it is so like organized, formal, and you know,
exactly.
there's so many like things, systems in place to reduce things like theft, things like control drug issues, things like,
Mhm.
just making sure that like people actually get their medicines and all that kind of stuff. So I guess that my next major question, and I think the question most people probably thinking of asking when they meet somebody who works as a pharmacist in Dubai is it worth it in terms of the money? Like, obviously, we know that Dubai and UAE lifestyle is luxury, and we want to go out, we want to have a good time, we want to live in nice houses, we want to drive the nice cars. But is the lifestyle as a pharmacist, the salary, the income, does it really match that kind of like Arab lifestyle that we all want?
Yeah. So sadly, not at all, not at all. And it's really sad and shocking, really. Well, I thought, I'll come back to Dubai, I'll be making bank, it'll be fine. Um, but no, not honestly, not at all. Currently, I was working at a university because that was the closest that I found to clinical pharmacy. So I found a university that would also offer clinical pharmacy. So I was teaching there because I couldn't find any other pharmacy job. And the retail pharmacies offer even worse salaries. So I am earning as much money as I used to earn as a pre-reg pharmacist
Oh,
after having 3 years of experience and having done the postgrad certificate.
you're saying that the retail pharmacists earn even more, like less than that.
Exactly. Yeah.
Wow.
Sadly, a lot of these people come from um, lower income countries. So for them, it is a significant amount of money that they can then take back home, and then
Mm.
it's enough money for them.
Mm.
But of course, to live that Dubai lifestyle that we all want, it's definitely not enough. It does not cut it. Yeah.
So I guess that my next kind of question as we kind of wrap up is like, where are you working now? How did you find that position and how are you enjoying that position?
When I came back and I said, I was struggling so much and it was so difficult for me, and with my frustration of what am I going to do? I literally cannot find a job.
Mm.
So I said, you know what? Let me approach one of the universities that offers this PharmD program, because apparently this is what I need to have to get that clinical license, and
Mm.
see how their graduates get a job, what they do as a job, and all of that. So I found one of the universities. I approached them and I inquired a bit of what they do. Long story short, they ended up hiring me as
Mm.
a preceptor, which is what they call someone that kind of coaches students in the
Yeah.
hospital. So like the interns. So they have this program called, their last year of the pharmacy degree is called API, which is Advanced
Yeah.
Pharmacy Placement Education. Yeah, you have it
Yeah.
over there as well.
Yeah, we do. Yeah.
Yeah.
But they don't
Um,
have it in the UK, so it's something that is good to talk
Right? It
about.
was new
Yeah.
to me as well. Yeah.
Yeah.
So they told me you could teach our interns in the hospital doing this program, and also teach some of the labs in the college. So I said, okay, you know what, that would be good. I'll keep my clinical knowledge at least working,
Mhm.
because this is like the best that I can get at the moment. So I think one of the things I mentioned to you before is that one of my frustrations is when I saw how practices here in the hospital is the organization and how guidelines are, because they don't have these hospital or trust guidelines that we
Mhm.
always used to rely on, or these national guidelines, like we have the nice guidelines in the UK.
Yeah.
Over here, they look at everything. They look at up to date, they look at the American ones, they look at everything.
Mm.
So for me, it's like, oh, I just want everything in one
One
place.
place. Yeah. Yeah.
How I was taught, or my university experience is so different to how I see the university experience for the students over here. And I think it really has to do with maybe like cultural differences as well.
Mm.
So I think the uni is a lot more lenient with students than compared to how we were when, or at least when I was at uni. Um, I was over here, students kind of get what they want. Over there, we were more scared of our lecturers and making sure like we got everything on time.
Yeah.
There was no leeway of, oh, maybe if I submit one day late, that's it. You probably would get a really low grade.
Yeah.
Over here, they're a bit more lenient. Oh, okay, fine. You submitted one day late, it's fine. So for me, it's I just have to stick to my values and the things that I've learned and the things that I think are right, even if they do things differently over here. And there's things that I don't agree. It's
Mm.
important that I stay true to myself, to the things
Yeah.
that I think are right, and I teach my students the way that I think things should be done.
So one of the things you talked about that again really just for me is it just it's exactly the same way I feel. It's about guidelines. And this is what I was saying, just going back to how much I appreciate the UK. And I think that if I could give advice to anyone, I would really advise them to study pharmacy in the UK if they can,
Yeah.
because there's a system and it really works. Like it really, really works. And I think when you're in the system, I noticed there were so many times that I complained about, you know, different things within the
Me
NHS,
too.
within pharmacy,
Yeah,
but
same.
when you leave, it opens your eyes and you start to see, oh my God, these things really work for us, especially things like having the control drugs register, having things like, on every control drug, you have to have like the license number of the doctor, you have things in words and figures, all the Harold Shipman stuff and those important things. Even having standardized prescriptions. I mean, I don't know
Yeah.
what other countries are like, but in Canada we don't have standardized prescriptions. Standardized prescription forms reduces so many problems, even
Yeah.
for the pharmacist. And I think that for me as a pharmacist in the UK, if I receive a prescription and it's say for example, it's like a dental prescription, but it's on a green form. Like, yes, there are some times where those things happen, but at the same time, you automatically have questions in your head because you know what a
Yeah.
prescription should look like, the signature, like all this stuff, right? Whereas
Exactly.
here we have prescriptions on just any type of paper,
Yeah.
just anything. Or one of the things that you mentioned was just about having those hospital guidelines. Oh my God, I did not realize how beneficial those were. I remember
Yeah.
when I was a junior pharmacist and I was working on a stroke unit, there was like, as soon as I had a stroke patient, I just knew we had like a document, a hospital document, which we have a formulary team at the hospital, which has a nurse, pharmacist, doctors on the team. They make up basically these guidelines, and you know exactly what to do. Like it tells you directly what to do. The same with NICE
Yeah.
guidelines. But working here, if a doctor prescribes something, I'm like, how do I like? What are we using? What are we like?
Yeah.
What's the
Yeah.
like? What's first line? What's
Exactly.
second line?
Yeah.
And it with the system in the UK, it helps with things like cost as well. Like they put cost and everything into it. What are your thoughts about like have you thought about maybe like implementing some of those things?
Just a little backtrack to what you said about all the information of where you know where it is and where to look. So I often heard this from one pharmacist tell me when I was training, and I always tell it to my students nowadays that being a good pharmacist is not about always about how much you know, but about where to look. That you
Yes,
need to know where to look to find the answer for things.
yes, yes.
So over here, it makes it a little bit complicated because we don't have easy access to many things.
Mm,
So one of the things that I always do for my students is I literally show them every single resource that I have, like going from like, I don't know, like renal drug handbook to
yeah,
enteral feeding
I still use
guide.
that.
Yeah, so and I share them with them and they love them. They say, "Oh my God, this is so easy to find information."
Mm,
So trying to start from there because this is a generation that's now going to be pharmacists in the
yes.
UAE. So
Yeah.
for me, it's important that I teach my students what is good practice,
Yeah.
and I teach them what are the kind of things that we used to do over there. And in my hospital itself, I've spoken to many other pharmacists that have good experience as well, and telling them, this is what we used to do. What do you guys think? How can we implement this here? Them having experience in Dubai, how does that fit? Because I understand that some of my frustration is that I want to change things because I'm used to things working a certain way, but there's also resistance from the other side that people don't see that, and sometimes they are resistant to change.
Yes.
So where can we meet halfway
Yes.
that we can change things, but also maybe not do a full change all at once?
Absolutely. Yeah, what you said is so important about meeting in the middle. I think when I first moved to Canada, I was very all or nothing. I was very much like, this is trash. We need to bring in the UK system
Yeah.
now. And
Yes.
I think I quickly learned that actually, based on where you are, based on the environment, you said something earlier about, how culture also has an effect on how people are trained and things like that. So I think the British culture is very organized. We do things this way and we stick to this pattern. So that's why things like that work in the UK. But
Yeah.
when you're in a different country, you have to kind of meet them in the middle, as you said, like, and be like,
Mm-hmm.
okay, this is what I know. This is what we already do. How can we like fix it and basically merge these two things together, kind of just like appreciating the work that this country is already doing or has done,
Hmm.
and bringing in your ideas and being like, okay, where can we kind of like merge things and stuff like that. What would you tell a pharmacist who maybe they want to like move to Dubai, even if it's for a few years? Like, what would your recommendation be? Like, would you recommend it? Would you say no? Would you say, don't come at all, or try it out? Like, what steps could they take to kind of like enjoy life in Dubai as a pharmacist?
So, so far, I would say that I don't recommend pharmacists coming to Dubai just because it's not worth it in terms of the salary of what we think. For me, I'm lucky because my family lives here, so I can work around that. But let's say if I came alone, I would really, 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 really struggle. So, in terms of the actual work, I think pharmacy is still in its, Dubai itself is still growing. It only has 40 something years. So, it's still in diapers basically. So
Yeah.
I'd say maybe if we wait a few years, maybe things will be better. Right now, the main issue is with the licensing. I know any pharmacist that comes from the UK will have the same problems as I am currently having. And
Hmm.
I know another pharmacist that also did the same thing, came from the UK. She never got her clinical pharmacist license either. However, because things are because there aren't strict rules, as we were just saying, sometimes you can get into things by knowing people, that someone that knows someone, and then you can get in, right? But if it's clinical pharmacy, I really recommend people to look into Abu Dhabi. Like I said, Cleveland Clinic is the most clinical pharmacy hospital in the UAE.
Yeah.
In terms of industry, it is obviously hard to get into industry. The more interesting roles will usually take time to get to. They always want you to start off as a medical rep.
Hmm.
And again, the salary is not great for a medical rep.
Hmm.
And community pharmacy as well, the salary is not great, and it's a lot of hours, maybe only with like a half an hour break. And as I
Wow.
said, it's not clinical. I mean, you could argue that community pharmacy in the UK is not as clinical as you would do in a hospital, but actually it's super, super clinical compared
Super clinical, yeah.
to what it is here.
Yeah. And do you have an idea, just a rough guidance of like how much community pharmacists in Dubai make? Like,
Yes, so roughly I would say like max right now would be 8,000 dirhams ish.
okay, 8,000, like a month,
A
or
month, sorry, yeah, a month.
so that's £1,800 a year. That's pretty low.
It's so 8,000 dirhams a month. So it would be 1,870 something pounds per month. Yeah.
That's really low, considering things are expensive in Dubai.
Exactly.
That's pretty low. Imagine if you had
Yeah.
family as well, like,
Yeah.
and that's working full-time hours, or
Full-time hours. Yeah.
wow. Thank you so much, Regina. I really, really appreciate this informative chat. Like, it's been so great to kind of like just hear your story, but also just hear like the positives from it, and know that there is someone who has moved from the UK to somewhere else and is experiencing similar to what I'm experiencing. Um, like, it makes me feel like I'm not alone in terms of like, the ways that the UK has trained us, and the stuff that we know and the stuff that we've been exposed to. Like, it makes me realize that I'm not the only one feeling kind of that, what is
Yeah.
going on in this country thing. Um,
Yeah.
how can people reach out to you if they want to reach you to ask you more questions, or if they're coming to Dubai and they kind of need like, direction with pharmacy, where can they reach you?
Yes, of course. So you can reach me on my Instagram. So my Instagram handle is Regina A Health. So I'm sure you'll put it down somewhere.
Yeah.
But yeah, anyone that has any questions, please, I'm more than happy to answer any questions. I've briefly talked about lots of things. So if you have any really specific questions, I'm more than happy to answer anything. So yeah, please reach out.
Thank you so much. Thank you guys so much for joining. Really, really appreciate it, and hope you enjoy the rest of your day or week whenever you're watching this. Take care.